The way of learning. Today's topic is hemophilia and Hodgkins lymphoma, exhibited for staff nurse interns. Hemophilia. Brief summary. First point. Hemophilia is a disorder in which blood does not clot normally. Second point. When blood does not clot properly, excessive bleeding, external and internal, occurs after any injury or damage. First question is, hemophilia is associated with option A chromosome 11, option B X chromosome, option C chromosome 21, option D Y chromosome. Correct answer is option B X chromosome. Next one is, in which disease blood does not clot? Option A thalassemia, option B lung cancer, option C hemophilia, option D diabetes. Correct answer is option C hemophilia. Next question is, hemophilia is transmitted to the option A male by the male through a receive sex linked characteristic, option B female by the male through a receive sex linked characteristic, option C female by the female through a receive sex linked characteristic, option D male by the female through a receive sex linked characteristic. Correct answer is option D male by the female through a receive sex linked characteristic. Next one is, hemophilia B is the deficiency of option A factor 7, option B factor 11, option C factor 9, option D factor 10. Correct answer is option C factor 9. Next one is, hemophilia A is characterized by deficiency of option A von Willebrand factor, option B factor 8, option C factor 9, option D factor 10. Correct answer is option B factor 8. Next one is, drug contraindicated into hemophilia. Option A aspirin, option B penicillin, option C ciprofloxacin, option D morphine sulfate. Correct answer is option A aspirin. Next one is, what is the most common feature of a child with hemophilia? Option A petechiae, option B hematorosis, option C bruising, option D clumping. Correct answer is option C bruising. Next one is, the following is most frequent classic site of internal bleeding associated with hemophilia. Option A brain tissue, option B GI tract, option C joint cavities, option D spinal cord. Correct answer is option C joint cavities. Next one is, which of the following is not a nursing care aspect for a child with hemophilia? Option A advice to get circumcised, option B advice to use a short toothbrush, option C advice to keep fingernails short, option D advice to wear padded clothing and a helmet while playing. Correct answer is option A advice to get circumcised. Next one is, a patient with hemophilia is brought to the emergency department after injuring his knee. The nurse should anticipate the need to administer option A fresh frozen plasma, option B RBC, option C factor 8 concentrate, option D platelets. Correct answer is option A fresh frozen plasma. Next one is, to control bleeding in a child with hemophilia, a nurse would expect to give option A albumin, option B fresh frozen plasma, Option C, factor 8 constant rate. Option D, factor 2, 7, 9 and 10 complex. Correct answer is option B, phosphorescent plasma. Next one is, which of the following is a safe game for a child with hemophilia? Option A, soccer. Option B, basketball. Option C, swimming. Option D, field hockey. Correct answer is option C, swimming. Hodgkins disease. Brief summary. Hodgkins lymphoma is a type of blood cancer that affects the lymphatic system, which is the part of immune system. Next one is, Hodgkins disease is a malignancy of option A, heart. Option B, lymph nodes. Option C, kidney. Option D, lung. Correct answer is option B, lymph nodes. Next one is, Hodgkin's disease is a disorder of option A, lymphatic cells. Option B, white blood cells. Option C, eosinophilic blood cells. Option D, basophilic blood cells. Correct answer is option A, lymphatic cells. Next one is, EP-15 virus especially affects option A, RBCs. Option B, T lymphocytes. Option C, B lymphocytes. Option D, platelets. Correct answer is option C, B lymphocytes. Next one is, in Hodgkin's disease into children, the sentinel node located at option A, near the left clavicle. Option B, axillary node. Option C, Gorion node. Option D, abdomen node. Correct answer is option A, near the left clavicle. Next one is, at time of diagnosis of Hodgkin lymphoma, which of the following area is often involved? Option A, back. Option B, neck. Option C, chest. Option D, Gorion. Correct answer is option B, neck. Next one is, which technique used to palpate lymph nodes? Option A, press nodes by both hand, index finger. Option B, rotate two finger pads in circular motion. Option C, feel the defect by back of hands. Option D, use all four fingers in horizontal motion. Correct answer is option B, rotate two finger pads in circular motion. Next one is, red Steinberg cells in nodes are found in option A, multiple myeloma. Option B, Hodgkin lymphoma. Option C, non-Hodgkin's lymphoma. Option D, leukemia. Correct answer is option B, Hodgkin's lymphoma. Next one is, the origin of myeloma is option A, epithelial cells. Option B, lymphocytes. Option C, plasma cells. Option D, fibrous tissues. Correct answer is option C, plasma cells. Next one is, the presence of which protein in urine is suggestive of diagnosis multiple myeloma? Option A, fibronectin. Option B, elastin. Option C, Beans-Jones proteins. Option D, collagen. Correct answer is option C, Beans-Jones proteins. Next one is, purpura is manifestation of option A, thrombocytopenia. Option B, leukocytosis. Option C, anemia. Option D, leukopenia. Correct answer is option A, thrombocytopenia. Next one is, the nurse cares for a patient diagnosed with autoimmune thrombocytopenic purpura. Which of the following nursing diagnosis is a priority when caring for this patient? Option A, potential for fluid volume deficit. Option B, risk for injury. Option C, risk for infection. Option D, risk for sensory perceptual alternations. Correct answer is option B, risk for injury. Thanks for watching. Like, comment and subscribe the channel.